So the impetus behind this study is I'm a geriatrician, and so what geriatricians do is we specialize in the care of older adults. Chronic kidney disease is highly prevalent in the older adult population. And from what I know from my geriatrics training is that depression is also highly prevalent in the general older population. One of the things that we think about in geriatrics is the predominance of things we call geriatric conditions. So things that are what we call multifactorial and affect quality of life. And I wanted to look to see if depression and geriatric conditions could be somehow associated with each other in folks with chronic kidney disease. I don't know if I would say if they are overlooked. I would say they are not the focus, even though they make up a large proportion of folks with either chronic kidney disease or end-stage kidney disease. And when you have an older adult, you have to pay attention to things like renal clearance, processing by the liver, and then also the burden for the patient. So thinking about the size of the pills, how many times a day you've got to take it, and then also the expense and access to a new medication. I mean, if you're depressed and you're older, and for whatever reason, if you're older and starting to lose your independence, you're a little, it's harder for you to get out of the house, you're potentially going to be less likely to do anything that you need to do to reduce your kidney disease. So meaning things like control your diabetes and eat properly and control your diabetes, take your medicines. I think, as people age, their worlds grow smaller, and it really impacts their outlook in life and their interaction with medical care.